Now, these are some varicosities and reticular veins on the posterior aspect of the leg. And she has short saphenous insufficiency or small saphenous insufficiency. So what we do is we're just going to mark the vein that we're going to remove. You only really have to mark the first one because once you inject this, after we do the ablation, we'll inject this and then take out the first varicosity. We'll inject this with also some solution to get rid of these. And I'll mark these. After we do this, we'll just actually make a little nick to express the stuff we inject. So we'll show you the ultrasound here in just a second. Now you can see this is these short saphenous vein coming up right here. You can see it right here. This is in the what we call the saphenous sheath. There's a branch coming off there. The varicosity I showed you is right coming off right there. So we'll take a RF catheter and we'll actually close down this segment from right here down to here, and then do the phlebectomy like I showed you with the area we're going to do. Okay.
This is our surgical pack that we use for ablations, and we're getting ready to set up for a procedure here.
This is the area we marked. I injected a little bit of foam here. It went back here. Tiny stick. I was using tumescent. First use a 3. We go a little bit deeper. This is all tumescent we're using. We want to be about 2 inches on each side of where we're going to do the phlebectomy. Okay. After that, we're going to use an 11 blade. Just make a little nick. You can also use a 1 millimeter punch right over the site. Use a small hook. And we'll go in and see if we can get this thing to come up. You can see we've used a hook to bring it up. There it is. We just try to take out as much as we can with gentle pressure. You can see it coming up. Here. See it going back this way. So this is a nice segment we're getting out. And we just avulse this. That's all you have to do.
And we just did an SSV ablation, micro-phlebectomy, ultrasound guided sclerotherapy, and we did some cosmetic sclerotherapy for this patient. This is our nurse Mariella, and she's going to show you how we wrap the patient. We wash the patient with an antibacterial soap and water, what she's doing now, and then we're going to dry her. And this is our setup here for our dressings, right here. And she's going to flip around, so I'll stop the video and restart. Okay, so we have the patient on her back now, and she's rubbing in this Dermica cream. The Dermica cream is going to help with the inflammation. It's going to help with the redness, the bruising, and potential staining or discoloration. So that will help. And then we'll have our patients put that on twice a day, once in the morning and once in the evening. We then use ABD pads on areas where we've done the micro-phlebectomy or sclerotherapy. Anytime we make incisions, we do a nice wrap. She's going to start at the foot and to anchor the dressing, and she'll use an ACE wrap, and she'll go all the way up. And this anchors the dressing, and then hopefully she'll have no swelling. And we tell our patients if the dressing's too tight when they go home, they can loosen it. And if it's too loose, they can tighten it. A lot of this is common sense. We tell our patients that they'll wear their dressing for 24 hours. They can take their dressing off tomorrow. They can shower. They can wash themselves. They can wash the incisions, suture sites, dry their leg. They're going to apply their Dermica cream, And then they can wear their compression stockings for a few days. It might be 2 days, might be 7 days. It's all about the patient's comfort. They wear their stockings just during the day only. At night they can take it off. I always tell patients not to swim or go into the ocean or lakes if they have sutures or incisions until the sutures come out. So she's just about done with the Curlex, and then she's going to use Curlex and then an ACE wrap. And we'll show you that too so you can see that. You don't want to make the dressing too tight. Okay, next is the Coban. I apologize, I said Curlex, I meant Coban. Now this Coban, there's chemicals in the Coban, so you want to make sure that you have a barrier between the skin and the dressing. You don't want to, if it touches the skin, it can cause some blistering. So if you have your nurse puts on that Coban and doesn't have Curlex underneath and the patient has blisters, you'll know what caused it. So this can get tight, this Coban. Okay, and lastly, we put on the ACE wraps. We start with a small 4-inch and then follow it with a 6-inch. And you don't want to make this too tight either. So she's going to wrap it all the way up the leg. And we always tell our patients that they can call us with any issues or concerns anytime. She will come back for a follow-up, and Dr. Bush will do an ultrasound and make sure the small saphenous vein is closed. Okay, I think you kind of get the picture here. She's going to wrap it up, and then we secure it with safety pins.